first listing, we're going to do a head of table thumb spinous push. We're going to do it at the C7 margin, and it's going to be a posterior right. So what I'm going to do is I'll have this. Drop this down just a little bit. There you go. So come through on C7. Tissue pool is going to be lateral to medial. Stabilize patient's head. Make sure that elbow is parallel to the ground. And then it's going to be right to left, lateral to medial. Next, we're going to do a prone index pillar push ipsilateral. We're going to do it the segment C4, and this would be for a left rotation restriction, right rotation restriction. So I'm going to come through, find the VP, and kind of take my tissue, pull on the patient. Go ahead and look away from me. All right. I'm going to traction with my inferior hand. Make sure that elbow is parallel to the ground, and then I'm going to thrust P to A. Next, we're going to do a seated pillar push on C4 on the right side. So for this contact, I'm going to stabilize his head. I'm going to slide out. My tissue pull is going to be medial to lateral. Then I'm going to come down here and stabilize his head. It's a little tall for me. I'm going to laterally flex his head and then rotate it away. And then for this one, my correction is going to be P to A, I to S. Next, we're going to do a seated hypothenar mastoid lift. This is going to be for a left lateral flexion restriction. So I would have the patient lean back onto my left leg, and I'm going to have the patient turn his head to the right. And then I'm going to slide up onto the mastoid process. Come around with this hand. Make sure my chest is out, shoulders are back, and it's going to be a nice little scooping motion for the adjustment. And my line of drive is lateral to medial. Last adjustment is going to be a supine anterior thoracic on the contralateral side. We're going to say this one's going to be at T8, so I'm going to have the patient roll over. And this adjustment is going to be skin on skin. So you find the inferior border of the scapula and go down until we find T8. We're going to use our thenar for this adjustment. Tissue pull is going to be P to A, I to S. And then we're going to roll the patient back over onto the contact. And then we're going to thrust. And then the line of correction for it is going to be A to P, I to S.